All right, Ruthie, Parks Mini Lab 101, demonstration. First, when you come in the morning, you might have to turn it on. This turns the machine on. Then you have to turn the computer on, which is this button right here. So both those buttons need to be hit and turned on. When it does, it takes about 4 minutes for the sequence to come up. You'll come up with the screen looking like this. Don't worry, it takes a little bit of time to go through the data and all that kind of jazz before it comes up, but this is the screen that'll come up. You'll notice that the num lock is lit. That shows that the computer is actually talking to the keyboard, which occasionally when it doesn't come up, you have to turn it off and back on again. We're going to go into a new study, lower arterial. This screen comes up occasionally. You just hit yes. Last name, patient's last name is hospital. You need to use capital letters. Patient's first name is Babs, because we already have Beverly in there. I want to make a new one. So that's the name of the patient, Babs Hospital. ID, put the medical record number in. Patient's date of birth. The gender. Accession number. Of course, that's what the current accession number is. What room? I usually put vascular 1, just to put something in there. Examined by William T. Irwin. I'll put your name in there so you can pull it up. Referred to, I can't remember the name of oh, that's a good name of the doctor referred to. At that point, those are the information you really just need to get for the front page of the sheet that prints out. Exit out of that. Then you go into the patient's history. Ask them a couple simple questions. Are you a smoker or were you ever one? Do you have any pain in your legs when you walk, right or left? Do you take blood pressure medication? Are you on medication for cholesterol? Are you diabetic? Do you have any pain in your legs at rest, right or left? Right? Okay. So in the notes section, I would come down here and say, whatever the indication is, patient presents with pain in right leg. Evaluate for PVD. Of course, fix any spelling errors. Exit out of that. Exit out of that. Then you'd go into select test. I have put everything on a custom sequence that goes through all the things you need to get, so it's just 1, 2, 3, 4 in a row. Hit a custom sequence, double click on resting protocol. The first thing that pulls it up is the right dorsalis pedis, or the AT. What I would do is take my Doppler probe that's usually sitting right up here. I go to the patient, find the AT. Oop, boom, 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 boom. At that point, I would F9 it to stop it. Go back if you need to, hitting the back key or the forward key. Once you find a waveform you like, you hit F10 to save it. Then it automatically goes to the segmental pressure of the right DP or AT. I would use my dark blue cuff, Doppler, take the red thing off obviously, and you want to use the hose with the nipple on it. So, obtain your signal. What you would do is inflate the cuff by hitting inflate right here. It automatically inflates to a pressure. Once you get to that pressure, you take it off. It'll slowly deflate. When you hear that signal return, hit F9. That saves the blood pressure, and at the point you hear the first signal. If you don't like it, you can back it up a little bit or something like that and obtain the proper pressure. Hit F10 to save it. The machine automatically goes to the right posterior tibial. Obtain that Doppler signal. Right posterior tib. F9 to stop it. You like it, you don't like it. Go back a couple. Save it. F10. Then it goes to the segmental pressure of the PT on the right. Use the same cuff, same thing, and same hose with a nipple. What you would do, again, hit inflate until it gets to a pressure you like, or until the signal stops. Take off the inflate. You'll wait a minute. That signal will return. F9 it to hold it. Back it up a bit. F10 to save it. Once you do that, it goes through the sequence of the same thing on the left side. Dorsalis pedis, or AT. Stop F9. Save F10. Then it goes to the segmental pressure. Oh, inflate. Deflate, it's coming down. I hear the signal, F9 to stop, F10 to save. Then it automatically goes to the Doppler of the posterior tibial on the left. You get a nice signal, F9 to stop, F10 to save. Then it goes to the segmental pressure of the posterior tibial. You're all still there, everything's all set up, so you don't have to move at all. Get a nice inflate, get it to where you want, stop, slowly deflate, signal comes back, F9 to stop, F10 to save. Then it automatically goes to the right brachial. You don't need to get a Doppler signal here, just a segmental pressure. So use the same cuff, same Doppler, same hose. You do the right brachial. Get the signal, inflate through that whole thing again. F9 to stop it, F10 to save it. Then it jumps to the left brachial. Same thing. Inflate, get the signal, F9 to stop it, F10 to save it. At that point, it jumps to the common femoral on the right. Get your Doppler waveform, stop it, save it. Then it jumps to the femoral. Same thing. Stop, save. F9, F10. Popliteal. Get the signal, stop, save. It jumps to the left femoral. Same thing. Stop, save. Obtain the signal, the superficial femoral next. Stop, save. Then it jumps to the popliteal. Get your signal there, stop, save. Now, you can go to the digit if you want. You don't have to, but if they have foot pain or something like that, it behooves you just to take a look and see if you can find the signal at the base of the great toe on the right. If you find it, stop, save, and then it automatically jumps to the left. Try to find it there. If you do, stop, save. At that point, you've gone through the sequence of the resting ABIs. I'd come down, I'd exit out of here, then I go to impression. In the impression part, I put preliminary, tech impression, and then I put in what I think. You don't have to do this at the beginning. They probably will just go ahead and read it without wondering what you're thinking, just because you're new at it. But if you want, you can put that in normal, not normal, what the resting ABI was on the right, what the resting ABI was on the left. At that point, you escape, come down to reporter. If you want to print everything, all you do is hit print. Sometimes the first time you hit print, it doesn't work. If you do, you have to do it again, but this time it seemed to work okay. It prints out the information. Then, once that comes out, you've checked it out, everything seems right, then you hit F12 down here to send it to PACS. I'm not going to do that just because I'm not going to send what we just did, but I escape out of that,